Welcome everybody to this press conference on the PABS Annex, where we'll be discussing a fair and equitable pathogen access and benefit sharing system and the importance of this to be negotiated soon. I'm joined here by four speakers. This is Daniel Ryer. He's the Europe Bureau Chief of the AIDS Healthcare Foundation. Then we're also joined by Ricardo Fernandes. He's the Executive General Director of the Treatment Activist Group in Portugal. Georgios Keratsas, he's the Communications Officer of Positive Voice in Greece. And we're also joined by Kęstutis Rudaitis, who will be representing Demetra from Lithuania, where he acts as a data manager. And we are also joined virtually by Agre Aluso. And Agre is the Executive Director of the Resilience Action Network Africa, RANA. And also by Kemi Gbadamosi. And Kemi is the Deputy Executive Director of the AHF Global Public Health Institute, as well as the director of the AHF Global Public Health Institute for Africa. My name is Tamara Prinsenberg. I am the Advocacy and Policy Manager of AHF in Europe. This event I will moderate with Kemi. She will be the co-moderator. We will be alternating asking questions to the panelists and guiding the discussion. Kemi will now start with some opening remarks on the PABS Annex. So Kemi, the floor is yours.
Thank you very much, Tamara, and hello everyone. Thank you for joining us for this very important conversation around the PABS negotiation, Annex negotiations. And it's a very pivotal time for the world in terms of how we respond and prepare for the next pandemic, not if, but when the next pandemic hits. And as we all know, that the WHO Pandemic Agreement was adopted in May 2025, but it cannot be ratified until a critical piece of that agreement is finalized, and that is the Pathogen Access and Benefit-Sharing, otherwise known as PABS Annex. Now, the Annex establishes rules for sharing pathogen samples and genetic data used to develop vaccines, diagnostics, and therapeutics, and how the resulting benefits from the use of the system are shared in return. Another thing is also the fact that time is running out for the world in terms of this negotiation. Because it is supposed to have the final round of negotiations at the end of this month, March. And failure to reach an agreement could force a weakened compromise or delay the pandemic agreement's ratification as a whole. Why is this important for now is the fact that what is decided now will shape whether the next global health emergency is handled more fairly than what happened during COVID-19. We all remember that during COVID-19, a lot of people were left last in line, particularly from the global south, when it comes to access to vaccines. We also realized that there were a lot of vaccine hoarding that cost an estimated 1.3 million preventable deaths. The bottom line of this is simple. The PABS Annex should not be approved without binding equity provisions and European powers, particularly the likes of Germany and Switzerland. We require them they must do the right thing to ensure that this happens. So the conversation today will center around why is this important now, but also why is it important even for the global south? Why is it important for the world at large when it comes to access to equitable vaccines, diagnostics, and therapeutics? So at this point, I'd like to turn the spotlight to Daniel Ryer, the Europe Bureau Chief, who will be taking the first question. And Daniel, the pandemic agreement has already been adopted, yet negotiations continue around the PABS Annex, which we have already mentioned is very critical. Why is this annex very important, particularly when we talk about the issues of benefit sharing and what is at stake in these final negotiations? The floor is yours.
Dear Kemi, thank you so much for your question. And before I answer, I wanted to just take us back a little bit and provide a little bit of background. Because I believe that we all agree that the last few years have shown us clearly that our global health security depends on cooperation. And that at the same time, we know that cooperation without fairness is not sustainable. I think today, every day, countries around the world share virus samples, genetic sequencing, and other critical public health data with WHO and with others. And it's really this sharing that is the backbone of scientific progress. The sharing of this data is what allows researchers to develop vaccines, diagnostics, and treatments at record speed. And we've seen so in recent years. And without this sharing, none of us is safe. And yet, despite this essential contribution, many of the countries that share this vital information are the last to benefit and the last to receive support when crisis hits. And we saw this very clearly with COVID-19. Countries around the world did the right thing. They shared information early, openly, and in good faith. But when the vaccines and the life-saving tools became available, access was anything but fair. Supplies were hoarded, deliveries were delayed, and entire regions of the world were left while others moved on, had vaccine passports, were allowed to go back into public life, with millions not accessing these vaccines. I think this experience must be our warning and our lesson. Now, Kemi, back to your question as to why the Pathogen Access and Benefit-Sharing, the PABS Annex, is so important. Today, we see some of the wealthy countries argue that benefit sharing should remain something that's voluntary, which on the surface may sound very reasonable. But in practice, we all know voluntary systems fail precisely when they're needed the most. When demand is high, when political pressure is intense, and when national interests take over, it's the voluntary commitments that are the first to disappear. And if we accept a voluntary approach again, what we are effectively choosing is to repeat the same mistakes we saw during COVID-19. We really are choosing a system that works in calm times, but collapses in emergencies. And that really is not good enough. This agreement must do more than express good intentions, and it must create clear, effective, and legal guarantees for all. Firstly, it must guarantee fair and timely access to vaccines, to tests and to treatments for all countries, and not only after a pandemic is officially declared, but during health emergencies as they are unfolding. As you know, viruses do not wait for legal definitions. Delayed access costs lives, weakens trust, and ultimately prolongs the crisis for all of us and for everyone. Secondly, fairness cannot be an afterthought. It must be built into the system from the very beginning. That means recognizing that sharing data and biological materials creates shared responsibility and not optional generosity. And this, to me, is where the Annex becomes vital and critical. The Annex must include binding commitments and not vague aspirations. Commitments that ensure technology transfer so that regions can produce what they need and when they need it. Commitments that support regional manufacturing capacity, reducing dependence on a handful of suppliers. And commitments for predictable financial contributions so that preparedness is funded before and not after disaster strikes. And these measures are not charity. They are smart, they are fair, and they are a collective insurance for all of us. And when all regions can respond quickly to outbreaks, everyone benefits. When manufacturing is diversified, supply chains are more resilient. And when trust is built through fairness, countries are more willing to share the data early, and early sharing will save lives. So then the question before us today is not whether we can afford binding benefit sharing. The EU certainly can and needs to lead the world on this. And it is not a question of whether we can afford it. It is a question of whether we can afford not to do this. If this agreement is to be credible, it must break with the past. It must ensure that those who contribute to global health security are not left behind when protection becomes available. And it must recognize that equity is not a moral add-on, but a practical necessity. Today we have a rare opportunity to get this right. So let us not settle for language that sounds good but changes little. Let us build an equitable agreement that delivers fairness in real time, during real emergencies, and for real people. Because the next crisis will not ask whether we were comfortable. And in Europe, we are comfortable. And in the beautiful offices here in Brussels, in the EU, everyone's comfortable. But that's not the question. What we will see is whether the PABS crisis, the PABS Annex, will reveal whether we were prepared and whether we were fair. Thank you.
You've left us with very strong responses here. I just want to highlight something that you said, that having a binding and equitable PABS Annex is not only smart, it is fair, and it's a collective insurance for us, for all of us, regardless of who or where we are. And the fact that cooperation does need equity and trust for it to thrive, because without that, there's not much that we can do. And we do not need voluntary commitments, because that hasn't really gotten us very far when disaster actually strikes. And so thank you very much for starting us off very strongly with those responses. And I hand now over to Tamara for the next question. Back to you, Tamara.
Thank you, Kemi. I'd like to turn to Agre now. Agre, another issue negotiators are grappling with concerns user registration and contractual obligations with the PABS system. Now, why are mandatory registration and clearly defined binding contract terms, why are they so important to ensuring the system is equitable?
Thank you, Tamara. Just I want to confirm if you can all hear me. Great. Yeah, I think yes, mandatory registration, and binding contractual obligations, I think is a very, very important element in this negotiation. And as Kemi in our introductory remark said, I think we are coming from a space where and a background where we learned lessons. We've been in a system that did not serve us well, and I think the starting point for the pandemic agreement negotiation was that we needed to shift and transform the systems from what they were, which did not serve us, to where we can be in a place where we can have a system that really can serve the interest of the world in terms of delivering equitable outcome. Because what all of us know in this day and age is that pandemics and epidemics are a global phenomenon, and are things that require collaborative and solidarity-based approaches, as the previous speaker mentioned. It's something that we cannot be sure that if you are on the rich side of the world, then you are safe because you can have the countermeasures. What COVID shows us is that nobody is safe until everybody is safe. And in this day and age of the connected globe, where one place, I can hear myself back. That can be sorted. One outbreak in one place of the world, can easily be in the next place 10,000 miles away in the next minute. I think we are only as good and as safe as our weakest neighbor or our weakest link, so to speak. So the motivation for pathogen access and benefit sharing was really to create a system that is departing from the previous. Discretional giving and philanthropic gestures, I think, can be good as a starting point, but they're not bankable. As somebody said, you cannot take somebody to court for a pledge. that they made when they were feeling good. When things change, like they have changed, we've seen how they have changed in some very, very important contexts. And they say, no, now I cannot give. You cannot leave the world at the mercy of whimsical, foreign policies of, rich, benevolent, partners in this ecosystem. I think what we need are, systems that are anchored on accountable frameworks. And these accountable frameworks, I think, can only be delivered if we have mandatory, and binding contractual agreement that have certain elements of legal certainty, as we all anticipating in the PABS agreement to be delivered. And therefore, they're not just technical details, but really the backbone of what can really deliver equity or can, reduce us, take us back to the system that have been producing existing imbalances and inequities. So for us, this is really one of the critical game changers, in this agreement, and we hope that it can be delivered in the way that it is being proposed. I know a number of partners, particularly for LMIC and those who are coalescing around the equity, have made very, very strong proposition around contracts and frameworks that would deliver legal certainty. And we want partners on the European side and countries that host pharmaceutical presence to really realize that this is something that is working for everybody. It's not just something that will deliver equity and support to LMICs or countries that currently are facing the inequities, but I think it will make the world safer. It will make everybody feel comfortable to go about their business and not worrying about the next pandemic. Because if we work collaboratively in systems that are bankable, that are that have accountability frameworks built within it, then we can be sure that the public good, which the pandemics, I think, and global health security is, are supported by global multilateral systems that are created to help deliver such services. And therefore, I think creating a system that is enforceable and that ensures that benefits, just like the access is guaranteed, is something that we think will be very important. And I just want to conclude by saying what some of the arguments that we've had in these negotiations is that if we have obligations around, and we've seen very unfortunate trends where even in the current draft, the parts that are talking about access to pathogen is mandatory, obligatory. And when they talk about benefits, now they introduce optional language. And you can see that in the current draft that will be negotiated from next week. And then I think what arguments that have been used to make such position is that if you introduce mandatory measures or obligations for benefit sharing, that it will create chilling effect on the innovation pipeline. I think that is a one-sided argument that does not appreciate that the importance of an ecosystem is that it needs to be incentivized from end to end. So if you value the outcome, you need to value where you're getting the information that will inform the outcome, the end product. And therefore, where the pathogens are coming from is just as important as where the data that is used to produce the countermeasures is going to take place. So both ends of the ecosystem are critical, and I think a mandatory and legally binding system is what will guarantee that. And it will be an incentivized system end to end, and you can be sure we'll get more real-time sharing of data than it has been ever before. And the world will be safer than it is currently. Thank you very much.
Thank you, Agre. You clearly highlighted that there's this imbalance between the pathogen access that countries are supposed to share all their pathogen data. This is mandatory and compulsory, but as soon as it comes to the benefits, it's not as clear. And I agree with you completely that there's exactly where we need those binding rules, that the benefits are also shared equally, and that will in the end result in a better global health security. I'd like to follow up on another question, Agre. Could you elaborate a bit on what the implication would be if we would not have an equitable PABS system?
Yeah, if we would not have an equitable PABS system, I think it would be back to the status quo, which we had pre-COVID, and we know how that ended. We ended up with a very long, drawn-out, pandemic that could have been, and could have been contained within a very short time, had the world been in the space to deploy its countermeasures equitably. And one of the surest ways, or one of the building companies, not like the only one, to that path towards equity would be to have this kind of arrangement that are being proposed within the PABS system. And I'm afraid if we are still going to, leave those, discretional framing, one of the arguments we were making when we got into this conversation, and I've been following this conversation from when it started, before the pandemic, the main pandemic agreement was concluded, where we had so many terms that are creating discretional elements, funds being available or on mutually agreed terms. Those optional elements are the same thing that existed before we had this agreement. So if we're going to revert back to those discretional optional elements, then why did we even get into this conversation for many years now? I think it's going to 4 years since we started these negotiations, because it's going to just take us back to status quo, which does not serve the purpose and does not meet the magnitude of the challenges that we face in the current world of heightened risk of epidemic and pandemic outbreaks. So for me, if we do not have a legally binding PABS agreement with the legal certainty that we're looking for, with an accountability framework that is anchored at the highest level of political accountability, I think it would be status quo, and I would rather we don't proceed with it as it is and take more time to get something that will really be transformative enough to help shape things from where they are to where they need to be, which is what we need. We don't need half measures. We need measures that are bankable and that can safeguard the interest of the world, and not just one side, one very, very small part of the world. Thank you.
Thank you, Agrey, highlighting again the importance of this of an equitable PABS system. This is exactly the reason why these negotiations are ongoing, and if we're not doing it right now, that history will repeat itself. I'd like to hand over to Kemi now.
Thank you, Tamara. And now we want to shift a bit to look at transparency and accountability, especially when it comes to the PABS Annex. And I'd like to turn the floor to Kestutis. Kestutis, another important issue in the negotiations is transparency and accountability. Why is it essential that benefit allocation criteria are clearly defined in advance and based on objective public health data?
Questions. I think there should be underlined some key points. So one of them is that any decisions regarding the allocation of vaccines, medicines, or diagnostics and other health emergency tools must be guided strictly by public health criteria. And it means that any political alliances or any economic power or geopolitical interests should not determine access to life-saving resources. The second, that clear rules should be agreed in advance, so countries know how resources will be distributed during a crisis or maybe next pandemics. And one more important thing is that transparency. And transparency fosters trust and fairness among countries. So open reporting on production volumes or supply distribution decisions ensures that no country, no company can operate unclear arrangements that undermine fairness. And maybe it's one more additional and very important thing, that civil society. So civil societies must be able to see the process, to be part of this supervision, and hold their governments and companies accountable. So these community voices are essential to ensure equity and not negotiation away.
Thank you very much. Just to highlight something you said that's very key. You did mention that transparency fosters trust, but it's also the fact that access should not be defined by geopolitical interests, but what benefits all of us as a whole. And this is very important when it comes to transparency and accountability for everyone, even as the negotiations continue. Tamara, I'd like to turn the floor back to you.
Thank you, Camille. I'd like to turn to Georgios now and discuss a little bit about the role of civil society in the implementation of PABS system. Georgios, for these negotiations and beyond, what role does civil society play in ensuring an equitable agreement and that it works in practice?
Question, and thank you to the whole AHF team for the invitation. Civil society plays a critical role in ensuring that the pandemic agreement, and specifically the PABS Annex in our case, results in an agreement that's both equitable and workable in practice for a number of reasons. First, civil society represents the communities most affected by health crisis and ensures that their voices are heard in global decision-making. Too often, international health agreements are negotiated far from the people who experience the greatest consequences. Civil society organizations bring the perspectives of patients, frontline health workers, and marginalized communities directly into these conversations. The HIV/AIDS history has shown us not only that activists and community groups can push governments to recognize the urgent need for equitable access to treatment, but also that when communities are not heard, the effectiveness of the response can be severely undermined. Civil society advocacy has helped transform the global response to HIV/AIDS and led to major initiatives such as the Global Fund to fight AIDS, tuberculosis, and malaria. However, one of the reasons that we have not yet achieved the goals set by the UNAIDS for the end of the AIDS epidemic by 2030 is that we have neglected those on the planet that are most disadvantaged. Most European countries say that AIDS as a syndrome is a thing of the past, but apparently that's not the case in some countries of Africa, for example. We should not repeat past mistakes, and we now know how to avoid them. Second, civil society helps translate global agreements into real action on the ground. International agreements can set the framework, but implementation happens at the national and community levels. Civil society organizations often act as the bridge between global policy and local realities, helping governments understand community needs and identifying barriers to access. During the COVID-19 pandemic, many civil society groups helped deliver information, counter misinformation, and support vaccination campaigns in communities where trust in institutions was low. Without that local engagement, even the best global agreements struggle to succeed. Third, civil society plays a vital role in promoting transparency and accountability. Equity commitments must be more than words on paper. They must be implemented and monitored. Independent civil society organizations help track whether countries and companies are meeting their commitments, including commitments related to access to vaccines, diagnostics, and treatments. The experience of COVID-19 demonstrated how essential this oversight is. Again, civil society played an important role in documenting disparities and advocating for fair distribution of the available vaccines. Fourth, civil society will be essential in explaining, defending, and supporting the implementation of the pandemic agreement in countries around the world. Public understanding and political support are crucial for successful implementation. Civil society organizations often serve as trusted intermediaries between international institutions, governments, and communities. They can help explain why pathogen sharing systems like the PABS mechanism are important, why equitable benefit sharing matters, and how these systems ultimately protect global health security. The lessons from HIV/AIDS and COVID-19 are very clear. When equity is not built into the system and when communities are excluded, inequalities widen and global responses become less effective. Civil society has repeatedly shown that it can push the global health system toward greater fairness, transparency, and accountability. Therefore, its involvement in the PABS Annex discussion is essential rather than optional. We, representatives of the civil society, can help ensure that the pandemic agreement becomes not just a diplomatic achievement, but a practical tool that protects all countries and all communities when the next pandemic emerges. Thank you.
Thank you, Georgos, and thank you for highlighting that civil society needs to be at the table both at discussing this annex to highlight what is needed on the ground, and if it's not just about signing a paper, it's also about the possibility of implementing it, and that's where those voices are really important. I now like to give the word back to Kemi.
Thank you very much, Tamara. Now, we are having this press conference. It's hybrid, but in person, it's in Brussels. And that's very symbolic because a large part of this conversation has centered around the EU, the European powers as well. And even from the information following the discussions, there is a focus on the EU. And this campaign itself highlights that the EU needs to stop blocking health equity. So I want to ask Ricardo, why is the position of EU powers so pivotal to advancing stronger equity measures in this process?
Thank you, Kemi, and thank you to AHF for organizing this important moment. Actually, it's really sad that we are having this discussion and the need to have to do this moment because this decision should be a no-brainer. So, getting back to your question of why the European Union is so pivotal on these negotiations is actually very simple. The EU is one of the most influential political and economic actors in the global health governance. And everyone knows that when the EU moves, negotiation move, and when the EU blocks or hesitates, negotiations stall. So in the case of the PABS annex that we've been discussing, the EU is not just another participant in the process. The European Union represents some of the world's largest pharmaceutical industries, major research institutions, and some of the most powerful voices in the international negotiations. This means that the position is its position of European Union can either unlock a fair agreement or prevent it from happening. And at this moment, unfortunately, we are seeing a situation where the current EU position risks weakening the equity commitments that the world urgently needs. We all remember, and it has been mentioned, I think, for almost every one of us, what happens during COVID-19. Countries in Africa, Asia, and Latin America, they share pathogens, samples, and genomic data very quickly and with transparency. And scientists collaborate globally at an unprecedented speed and level. But when vaccines and treatments became available, access was deeply unequal. That experience created a very clear lesson: sharing pathogens without sharing benefits, it's not solidarity, it's extraction. The purpose of the PABS system is precisely to correct that imbalance that we saw in the past. From the perspective of civil society organizations like the GATT, the one where I belong, this discussion is very familiar. The HIV movement has lived through this before. We know very well what is happening. So equitable access does not happen automatically. It requires political decision. Through our work in Europe and partnerships across Portuguese-speaking countries in Africa, we see clearly how important equitable systems are for public health, and everyone that visits Africa, African countries, can see why this is important. This is why we are so related to PABS negotiation, and this matters so much to us. The European Union frequently presents itself as a global leader on solidarity, human rights, and multilateral cooperation. So now leadership means also translating those values into concrete positions. At this moment, the EU has the power to help break the current deadlock. A shift from the EU would send a very powerful signal. So Europe has the power to unlock this agreement. Europe has the responsibility to support equity, and Europe must ensure that the next pandemic response is fairer than the last one. Thank you.
Thank you very much, Ricardo. And just to sum that up, you summed it up very well. And it's the fact that the EU for a long time has championed solidarity. And now more than ever, the world needs it to stand behind what it has long championed when it comes to solidarity, basically saying they need to walk the talk. And I think that's why these conversations are happening around the world when it comes to the PABS Annex, and we're calling on them to do the right thing. So thank you very much. Tamara, over to you.
Thank you, Kemi. Just wanted to highlight another few things around the role of parliamentarians, the role they can play in strengthening healthy systems to achieve global health security. And I want to talk about this with Kemi also. What do you feel that the role of parliamentarians should be in achieving equitable and fair PABS Annex, Kemi?
Thank you, Tamara. I think one thing that is very clear, even just listening to the speakers, is the fact that this is an issue that concerns all of us, from civil society communities all the way to governments, to stakeholders, even looking at pharmaceuticals. It is an issue that concerns all of us, and equity has to be at the heart and the center of it, not just on paper, but in reality. And parliamentarians play a very key role, even at the country level, at the regional level, and the fact that they play oversight functions as well. And we need more parliamentarians to also join in this conversation, to join in this advocacy, to ensure that government positions right from the country level, they reflect in the global health negotiations, and that it prioritizes equity. So that's one of the things we're asking for, that parliamentarians use their influence, even at the country level, to push for these negotiations to prioritize equity and also prioritize global health security. Because like we've all said it many times over, I think it became one of the very key comments that came out, is that no one is safe if we're not all safe if no one is safe. And so we would like for parliamentarians, they do have a role to play when it comes to that kind of oversight. And this includes the parliamentarians from the EU, EU powers as well, to be able to push to say we need to prioritize health equity and health security even as these negotiations continue. Another thing is also leveraging their influence, like I've mentioned, to engage negotiators. We should not leave this to just negotiators alone, but these are conversations that should start from the bottom up. We're seeing that a number of the developing countries are pushing back and asking for more equity. And we think that parliamentarians will be very key in lending their voices. We also want to hear them add their voices to this advocacy as well. The EU and the European bloc, I talked about it earlier about the fact that they champion solidarity, which is a good thing. And now is the time for parliamentarians from the EU bloc as well to ensure that commitment is delivered in practice. It is important, the onus rests on even members of parliament to ensure that the PABS Annex delivers on its promise, what it was designed to do or what it's been designed to do, that it delivers on it at the end of the day. And lastly, just to say that it is important for parliamentarians to also rally support for an equitable, a fair PABS system, recognizing that it is important for global health security at the end of the day. So we're having this conversation and putting the spotlight on members of parliament because of the influence that they wield at community level. We require them to also hold governments accountable. I know that yes, we'll get to the point where we will speak on implementation by the time we're done with this process. And that is also where they also come in very handy as well. But it's the fact that they also need to be a loud voice that says we have to put lives over profit. And here I'm putting the spotlight more even on members of parliament from the EU bloc to say you need to champion that. We've heard that a number of European countries are actually speaking strongly in favor of equity. We want to hear more voices from the EU bloc. And last but not the least, they can ensure that this agreement, when after all is said and done, that this agreement does not just remain a document, but it can be actually translated to real action at the country level for the benefit of the communities that actually need it the most. Thank you.
Thank you, Kemi. Very well said. Indeed, this agreement, we want this to be able to translate and into real action and benefit those that need it the most, and by doing that, ensuring global health security. We're getting close to the end, so I just want to have the last closing remarks. Sure. Yeah, go ahead. So.
So, hello, can you hear me? Is that record? Yeah, great. So, I was following this issue quite some time back when it was going through the difficult negotiations, and it was obviously, they kicked the can down the road, hoping to solve it later. But the impression I got is that the EU is definitely not supportive of this. And I'm just wondering if you, as a group, or whoever you're reaching out to, do you hear anything to the contrary? Is there support? Is there a mixed picture across the EU? Are there people supporting your case? Because I don't see any support for it at the moment. And I have to say, I also find it a bit difficult to understand how it would actually work in practice. And so my second question would be, is there an alternative to this? Is there something that would produce the same results but work in a different way? Thank you. Sorry, I should say who I am. I'm Catherine Fiore, I'm a health journalist. Thanks.
Do you want to take this question, Daniel? Or?
Sure, I can. Let me start on the first question, and then maybe Ricardo or someone else wants to say something. I think part of the challenge that we have in these kind of campaigns is that we address the EU, but the EU is the sum of many member states, of course, and there are power differences, I would say, but there are a number of countries that are very clearly in support of this PABS and of what the equity that we're also trying to push as AIDS Healthcare Foundation and our partners. Unfortunately, I would say the stronger countries, and especially the largest economies, are less in favor of this. But their public relations paint somewhat different stories. So I think that's where we see some space. But countries, for example, like Spain, has taken a very clear stand in favor of these negotiations, and so there is hope.
I just wanted to add that you were asking about possible solutions. I think that's also, of course, the $1 million question, or euros in this situation. But what we know is what we should avoid. Currently, the United States are doing bilateral deals with each country in the South, which is, of course, very profitable for the US and not for the countries. So I think the EU could lead this, not only from a point of view of solidarity, but also strategically, it will be better for all the companies that maybe are lobbying against the PABS Annex. It could be more profitable for them to have more countries from the south engaging, with us than the opposite. Because otherwise, I think that if we have the next pandemic, and we will have it, we know it, we will have troubles to develop strategies and answers, because we will not have enough data and material for the companies in Europe to work around possible vaccine or strategy to solve that. So this means that it will be even worse in Europe, the pandemic, and in the world. And if we want to think economically, also other powers will be winning again. So this is not what is happening now. It's a bad deal for Europe, for European Union, and it could be a better deal if they do go on with the PABS Annex. But of course, I understand your question, and what we need we need to have a balanced solution that it's good for European Union, but it's good also for the countries on the south, because otherwise we'll have the same. You were hearing and about the ordering and all the things that happen, and that are not favorable for Europe or the countries in the south. And this is also the impact. This impacts the pandemic, and we shouldn't forget that any pandemic anywhere, it will arrive to Europe if we don't treat everyone. So this is the important thing to know. We need to treat everyone.
Any other questions? No. Also don't see any questions online. In that case, I am going to close down. So what we are demanding that the EU stop blocking health equity and finalize the agreement. We applaud developing countries pushing for binding equity rules, including Spain, Belgium, Luxembourg in Europe, along with Brazil, Malaysia, Thailand, Pakistan, Namibia, Indonesia, and many global South partners. A weak annex risks repeating the vaccine apartheid of COVID-19 while putting all countries at risk. We call on EU leadership to join the Global South in supporting mandatory benefit sharing, legal certainty, and real accountability. The EU must align its position with the values it champions. A strong PABS annex is not symbolic, it saves lives. Thank you.